Recognizes the gentleman from California.
Thank you, Mr. Speaker. I ask unanimous consent that all members may have 5 legislative days in which to revise and extend their remarks and to insert extraneous material in H.R. 4673 as amended.
Without objection.
Thank you, Mr. Speaker. I yield myself such time as I may consume.
Gentleman is recognized.
Thank you, Mr. Speaker. I rise today in support of H.R. 4673 as amended, my bill, the Ensuring Veterans Smooth Transition, or EVEST Act. I've made suicide prevention a top priority for the House Veterans Affairs Committee. Last Congress, we passed bipartisan, bicameral mental health legislative packages, including the Commander John Scott Hannon Veterans Mental Health Improvement Act and the Veterans Compact Act. This Congress, we continued this work by passing the Sergeant Ketchum Rural Veterans Mental Health Act into law, but there's always more to do. EVEST builds on our work and finally closes one of the most glaring gaps for veterans being able to successfully access high-quality VA health services, the enrollment process. We shouldn't be trying to hide VA care from those who earned it. We know that the months following transition out of the military can be very stressful and particularly risky for new veterans in terms of mental health. With the EVEST Act, service members will be automatically enrolled in VA care during their transition out of the military with the choice to opt out. This helps simplify the process and prevents veterans from potentially missing out on life-saving care. It also keeps veterans from having to opt into VA care later and attempt to navigate a new bureaucracy all on their own. The symptoms of PTSD can be significantly improved in veterans who receive prompt mental health care. A 2014 study led by researchers at the San Francisco VA Medical Center looked at nearly 40,000 Iraq and Afghanistan veterans who received VA mental health care between 2001 and 2011 and had a post-deployment diagnosis of PTSD. They found that veterans who sought and received care soon after the end of their service had lower levels of PTSD upon follow-up a year after they initiated care. Each year that a veteran waited to initiate treatment, there was about a 5% increase in the odds that their PTSD either not improving or getting worse. Mr. Speaker, I ask unanimous consent to enter the study from the San Francisco VA Medical Center into the record.
Without objection.
Thank you. A smooth care transition from DoD to VA can help support veterans as they adjust to the next phase of their lives and provide easy access to health care should any challenges arise. Everyday Americans find it difficult and frustrating to sign up for health care. Now imagine that you've just come off active duty military service where for years you were told when and where to show up for your health care. You probably heard something about VA services during your transition assistance program, but frankly, you were focused on everything you had to do to finalize separation from the military and possibly looking for new employment and relocating your family. Now, after having separated from the military, you're a veteran. And maybe for the first time, you have to figure out how to check your eligibility for VA health care and navigate the system while potentially also facing some new stress in your personal and family life. This is completely avoidable with EVEST, which simply enrolls you in the VA health care for which you're already eligible, ensuring that when you need VA, there aren't any unnecessary roadblocks to seeing a doctor. Now let me say that again. This legislation has nothing to do with a veteran's eligibility, nor does it change VA standards or who is eligible. It only connects eligible veterans to VA care faster and easier. We know that veterans are much more likely to use VA services and care when the process to enroll is simple. And we know that VA care is world-class. EVEST is a straightforward tool that will allow us to simplify the transition process and take steps toward preventing veteran suicide. Automatic enrollment is something policymakers and veteran service organizations and stakeholders have been trying to advance for years. And with eVest, it will finally become a reality. Paralyzed Veterans of America and Disabled American Veterans have formally endorsed this legislation. The Nurses Organization of Veterans Affairs, the American Federation of Government Employees, the Veterans Health Policy Institute, and the American Psychological Association also support eVest. And again, Mr. Speaker, I ask unanimous consent to enter into the record letters of support from the Nurses Organization of Veterans Affairs and the Veterans Health Policy Institute.
Without objection.
Now, I wish to thank Speaker Pelosi and Leader Hoyer for considering this legislation today, and I urge the rest of my colleagues to support this vital legislation to increase access to care and ensure a smooth transition to civilian life for veterans. Thank you, Mr. Speaker, and I reserve the balance of my time.
The gentleman from California reserves. The gentleman from Illinois is recognized.
Well, thank you, Mr. Speaker. I yield myself as much time as I may consume.
Gentleman is recognized.
Thank you, Speaker. I rise today in opposition to H.R. 4673, the Ensure Veterans Smooth Transition, or eVest Act. You know, this bill would require VA to automatically enroll every eligible separating service member into the VA healthcare system. You know, as a veteran, I know firsthand as a transition from military to civilian life can be hard. One of the goals is to remove barriers to care for veterans, whether they left the military decades ago or just last week. I believe the intention of the eVest Act is to further that goal by connecting more at-risk service members with the VA as they leave the service. Now, I support the intention. I know many of other members do as well, which is why I expect the bill to pass the House and probably on a bipartisan basis. However, as a ranking member of the VA committee, I have a different perspective on this bill than many of my colleagues. I have taken a long, hard look at this legislation, and what I have seen is a bill that may be well-intended, but has several potential problems. To start with, the eVest Act enrolls separating service members into the VA healthcare system without their knowledge or consent. Only after they've been enrolled does the bill require VA to inform the veterans of their enrollment, the status of their enrollment, and how to opt out by disenrolling themselves. We shouldn't be signing veterans up for a government program they aren't asking for, and many even may never need without at least letting them know first. And we shouldn't be telling them that if they don't like it, they can figure out how to disenroll themselves. That's backwards. Veterans deserve better than that. Veterans also deserve better than a bill that has been rushed through Congress without due diligence. There has never been a single hearing on the eVest Act in this Congress. You may hear the chairman say that there's been a hearing on this bill last Congress. That's true. But last Congress and this Congress are very different. We had a different administration last Congress. We had a different VA secretary last Congress. I believe more than 70 members are new this Congress. More than half of the membership of the VA committee is new as well. And regardless, VA did not provide testimony at the hearing last Congress. We have no idea if VA can implement the bill without disrupting service to the veterans already in the VA health system, further burdening VA's already overworked staff, or increasing the strain on VA's already overfull facilities. Every member of the House hears from veterans in our district who are waiting too long for care they need, stuck in crowded VA facilities, and being treated by VA staff who are struggling and overwhelmed. I'm concerned that this bill could make each of those things worse. I'm not the only one who thinks so. Last week, right before this bill was considered by the Rules Committee, the Biden administration issued a statement of administration policy on the eVest Act. The statement reads, and I quote, there may be challenges implementing this bill as drafted by, and the administration looks forward to working with Congress, end quote. In other words, even the president recognizes that this bill needs more work. Mr. Speaker, I ask unanimous consent to include that statement of administration policy into the record.
Without objection?
Thank you, Mr. Speaker. And to be clear, the VA committee has numerous opportunities in the last year to do that work that I had just discussed. And I don't know why the chairman chose not to. I've heard him say over the last week that it's okay we didn't have a hearing on the eVest Act in this Congress because the bill has been in the public domain. Now, I'm not sure what that statement really means because there's been almost 400 bills introduced in this Congress that have been referred to the VA committee. I guess that each of those are in the public domain. But I don't think any of them are ready for a vote here on the House floor. It's not too much to ask that we seek the input from stakeholders before voting on a bill to become law. That's actually the least we can do. And yet I don't think our constituents sent us here to do anything less than that. You know, during last week's Rules Committee, Congressman Torres, a member of the Chairman Takano's own party, seemed to agree with me by lamenting that the lack of process on this bill has received this Congress. With all due respect to the Congresswoman, I doubt that we agree on much. But we do agree on this, though. Having this bill go through much more robust process, this Congress could have resulted in a much better product for our veterans. Finally, I want to note that the bill will also cost taxpayers $3.1 billion in new discretionary spending. Not a penny of that $3.1 billion is offset. Implementing this bill will certainly require additional funding above the nearly $100 billion already appropriated for the VA healthcare system. We cannot keep saddling our children and grandchildren with billions more debt. We have to do better than this. With that, Mr. Speaker, I want to reiterate that I understand why my colleagues would likely vote for this bill. I wish I could vote for this bill as well. You know, leaving the military wasn't easy. It can leave new veterans feeling adrift and alone. I've been there. But that's why I support efforts during the Trump administration to improve the Transition Assistance Program and increase the VA's outreach to separating service members during their first year out of uniform. I want separating service members who need additional support to be able to get it and the help that they need and in a seamless manner. And I am not at all confident that this bill will accomplish that goal without harming services to other veterans and adding to the national debt. As a result, I must oppose it today, and with that, I reserve the balance of my time.
The gentleman from Illinois reserves. The gentleman from California is recognized.
Mr. Speaker, I reiterate that we should not be hiding the care that our veterans have earned. Let me just quickly say that this bill has been in the public domain for 2 years. It was reintroduced last summer, and the minority has had over 6 months to talk with us and the VA about it. Furthermore, the committee has held 6 hearings on suicide prevention and transition since 2019. The common sense of this bill shines through. And let me just also add that regarding the capacity of VA, and I'm glad that the ranking member has entered the statement of administrative support into the record, that statement clearly says and declares the administration's support and its willingness to work with the administration. Data shows that the VA enrollment has been going down in recent years, and while new enrollment hovers around 400,000 per year, it used to be double that, around 1 million per year, and using current assumptions, VA projects veteran enrollment in VHA to remain relatively steady from 2019 to 2029. I am very, very confident about VA's ability to absorb the additional veterans that will take advantage of VA's world-class health care. At this time, I'd like to yield 5 minutes to my good friend and member of the House Committee on Veterans Affairs and the chairman of the Subcommittee on Technology and Modernization, the gentleman from Indiana, Chairman MRVAN.
Thank you, Mr.
The gentleman is recognized.
Thank you, Mr. Chairman, for the time. It is my honor today to rise in support of H.R. 4673, the Ensuring Veterans Smooth Transition Act. I appreciate the leadership of Chairman Takano to advance this critical legislation that will require the VA to automatically enroll individuals who are separating from the military into the VA system. Our brave members of the military put their lives and health on the line every day to keep our nation safe, defend our democracy, and protect our freedoms. We have a responsibility to make it easy as possible for them to transition from military service to civilian life. And I am pleased that this legislation does just that. My experiences have afforded me the opportunity as a former township trustee in Northwest Indiana to work every day with the veterans community. I was able to initiate a Veterans Services Roundtable and bring together veteran organizations to discuss, coordinate, and streamline much-needed resources for our veterans. In many instances, it was not that the resources or the benefit was unavailable, but rather the individual was unaware of the existing benefit or unable to access, for whatever reason, the very resource they needed. Today, I am thinking of those countless discussions and individuals as I will vote to support the eVest Act. It is an effective proposal to help ensure that veterans access the valuable health care services available to them during this transition process from active to veteran status. Today, I want to make sure we meet our veterans' mental health needs and increase the veterans' access to health care. I thank you again, Chairman Takano, and my fellow members of the Veteran Affairs Committee for your commitment to supporting veterans and bringing this measure to the floor today. I urge my colleagues to support this measure, and I yield back my time.
The gentleman from California reserves. The gentleman from Illinois is recognized.
Thank you, Mr. Speaker. You know, in response to the eVest Act has been in public domain, I think it's very important. You know, this Congress, as I mentioned earlier, the last Congress is not the same as this Congress. We have more than 70 members who are new members of Congress. And so if half of the VA committee is new as well, we have a different president, we have a different secretary. You know, introducing a bill is not the same as conducting a hearing. It's not the same. You can't get the input from the stakeholders. You can't engage in meaningful debate in the public domain. This reflects zero input from the VA, meaning we have no idea whether it's flexible, whether it's workable, whether it's disruptive to the VA system. We don't know. And even the Biden administration agrees that more work is needed before this bill should become law. And the previous speaker, Mr. Speaker, spoke about a person that didn't know what was available to them through the VA. You know, if you were my age as a veteran, it's truly that you could not know because you got a quick class and the TAP program, and I've mentioned on this floor before, is a tap on the back and see you later. But today's TAP program is a course that you take, and you are bound to go and understand separation from your service, active service, and what the VA and other benefits are available to you. And not only that, the Trump administration in 2018, I think it was, put an administrative order out that you are then contacted after separation at 90, 180, and 360 days out to be notified of what the benefits are for you in the VA. We are doing that. This instead enrolls members without their consent, and then they're enrolled, and the only option they have is to be notified later that maybe they can get out of being enrolled. So with that, I reserve the balance of my time.
The gentleman from Illinois reserves. The gentleman from California is recognized.
Thank you, Mr. Speaker. I just want to add that in response to the esteemed ranking member, VA formally supports this legislation and has been discussing auto enrollment for years. VA has already been working to make transition into VA healthcare smoother with Solid Start, and we'll soon have data showing that warm handoffs have a positive impact on veteran outcomes without overwhelming the VA system. In response to the criticism that VSOs have not had input, I just want to point out that VSOs, including Paralyzed Veterans of America and Disabled American Veterans, have also already formally endorsed eVest. Because why? The common sense of this legislation shines through. All VSOs have had a chance to weigh in, and many did. The Nurses Organizations of American Veterans Affairs, the American Federation of Government Employees, and the Veterans Health Policy Institute, and the American Psychological Association also support this legislation. And with that, I'd like to yield 3 minutes to my good friend, a former member of the House Veterans Affairs Committee, who now serves on the Agriculture Committee, Homeland Security Committee, and House Judiciary Committee from the great state of California, my own home state, Representative CORREA.
Gentleman is recognized.
Thank you, Mr. Chair. Mr. Speaker, today I rise in strong support of the eVest Act. All gave some, and many made the ultimate sacrifice. And America has made a promise to our veterans that we would take care of them when they would return home. I represent Orange County, California, and many of my constituents have served their country proudly. One of my constituents, Billy Hall, from City of Orange, enlisted at the age 15, served from 1941 to 45, World War II, and again from 1948 to 1967 in the Korean and Vietnam Wars. And every service member deserves our respect and gratitude, and most of all the benefits and care that we promised them when they would return home. This legislation, this bill is very simple, but very important. It automatically enrolls veterans in the healthcare system. It provides veterans health care without the red tape. And I urge my colleagues to vote yes on eVest and pass this simple and important common sense legislation for our veterans. And with that, I yield back.
Serve.
The gentleman from California reserves. The gentleman from Illinois is recognized.
Thank you, Mr. Speaker. I would ask just simply, in my debate and the things that I brought up here today, I never said the VSOs didn't have input. I did say the VA did not come to the committee. We did not have the proper hearings. And if the VA is in support, I would request that the VA would then send the documentation saying how they are in support of this bill. Their input would be vitally important. Whether it's a Republican or Democrat administration, the VA is vitally important to make sure they provide services to our constituents and to our veterans. No one on this floor cares more about the veterans than the people that serve on this committee. I can guarantee that, whether it's the chairman or myself. But we've got to make sure that what we're providing does what it is we're trying to say. It was mentioned earlier that the VA, that they believe that this would help reduce suicide among transitioning services members. You know, I deeply care about this. This is something that both I and the chairman have worked on and will continue to work on. The majority of the veterans who die of suicide have not had meaningful engagement with the VA. They may have been enrolled in the VA, but they haven't gotten the VA care that they need. This bill would add names of eligible separating service members from the VA and put them on the rolls. But it doesn't do the reach out that is necessary to possibly prevent them from that ultimate decision to end their lives. And, you know, those are the type of things we are working on and will continue to work on. This is not the answer to that. There's a lot of other concerns that I have expressed and will continue to express. With that, I will reserve the balance of my time.
The gentleman from Illinois reserves. The gentleman from California is recognized.
Let me just say that the amendments that we are considering also to this bill today, which I consider friendly, will address many of the ranking members' concerns about the reaching out. I would like to yield 3 minutes to my good friend who serves on the Financial Services Committee and the Select Intelligence Committee, the gentleman from Connecticut, Representative Himes.
Gentleman is recognized.
Thank you, Mr. Speaker, and I'd like to thank Chairman Takano for moving this very, very important effort. In this polarized and angry time, one of the lights of this institution is that we have always come together to better serve our veterans, to better serve those men and women who took the ultimate risk and were prepared to make the ultimate sacrifice on behalf of all of us and the system that this room embodies. And this is a real problem. As I go around my district and I talk to young veterans, they face any number of transitional issues with housing, with health care. And let's face it, the change from being on active duty to being a veteran is a challenging one that all too often results in the kind of tragedy that we've acknowledged in this chamber here today. And so I rise in strong support of the eVest Act. It's consistent with something that I'm very proud to have accomplished many years ago when we passed the SERVE Act, which made it easier for veterans to show that they had housing, to show that they had an income so that they could get the housing under which they were entitled to. It was a small thing, but it just eased the passage for those young men and women who have so well served this country. This is important, and it's not a big deal, but it's going to affect tens of thousands of veterans. My Republican friends know that I respect and value their input and their objections to our ideas. It makes us better when you pose objections to our ideas. But I'm a little puzzled by the objections that I'm hearing today. I've heard sitting here that this is not paid for. Okay, it's $3 billion that I think is well spent on perhaps the most valuable population that we have. But the notion that we're not paid for, let's remember, it was just a couple of years ago that my friends on the Republican side passed $2 trillion in tax cuts, 83% of which benefited the top 1% of this country's citizens. I gotta believe that if we can do $2 trillion in tax cuts that largely benefit the richest Americans, that we can find $3 billion to ease the passage for our veterans. I've heard the ranking member say that the VA maybe can't handle it. Let's remember the VA supports this idea and that we're just asking them to do a little bit more of what they already do. This is not some new and fanciful program. No, it's making a program that is well established available to more. This is a good bill. I'm particularly proud, and my friend and neighbor Joe Courtney will talk about this shortly, that my neighbor Johanna Hayes is proposing an amendment that will increase the notification that goes to veterans about what is available to them. This bill needs to pass because at the end of the day, we're answering a question. Do we want more veterans to have access to what we have promised them? Or do we want fewer veterans to have access to what we have promised them? That's what's at stake here. So I thank the ranking member and would urge him to rethink his objections to this bill because this will be a proud moment when this bill passes. With that, Mr. Chairman, I yield back.
I reserve.
The gentleman from California reserves. The gentleman from
Reserve.
Illinois also reserves. The gentleman from California is now recognized.
Mr. Speaker, I have no further speakers, and I'm prepared to close.
And reserves.
On a reserve.
Gentleman from Illinois is recognized.
Thank you, Mr. Speaker. You know, I've mentioned many times this morning that the VA committee did not that the VA committee did not do our job on this bill. We did not consider this bill in a legislative hearing. We did not seek input from stakeholders or the VA. We did not make certain that automatic enrollment, newly separated service members into the VA healthcare system would not impede access for existing employees or cause funding crises. And those things are very, very real. Even the Biden OMB has admitted that there are going to be challenges with implementing this bill. You know, if you look at the numbers, and I'm going to add this in to what should be mentioned, 19.1 million veterans is what we have. 9 million veterans are enrolled. 7 million use access to the VA. If we start and do it this way without letting veterans make decisions on their own, it can overwhelm the VA. And that's what has been mentioned by OMB. You know, veterans are already facing tough challenges, so it is the VA health system that they can go to. But we don't need to add any more to their plates without at least hearing how it's going to affect the services that are already being provided to our veterans. You know, that's why, just so you know, I'm offering a motion to recommit this morning. My motion to recommit, if adopted, would send this bill back to the VA committee to consider an amendment to H.R. 4673, which would delay implementation until 30 days after VA has certified that it can implement without disruption services to the veterans or requiring additional funds. I don't see how those who support this bill, despite its problems and the Biden administration's recognition that it may cause challenges, can object to this type of this amendment. The very least we can do for the millions of veterans who are already enrolled in VA care and counting on that VA services is to ensure before this bill goes into effect that it won't cause undue harm to them. You know, I've already drafted the amendment, and that would accomplish this goal. Mr. Speaker, I ask unanimous consent to include this text of my amendment into the record immediately prior to the vote on the motion to recommit.
Without objection?
Thank you, Mr. Speaker. I urge my colleagues to support my motion to recommit, and with that, I yield back the balance of my time.
The gentleman from Illinois yields back. The gentleman from California is recognized.
Mr. Speaker, let me just say in response to my friend, the esteemed ranking member, that his MTR, which would delay implementation in order to avoid harm to our veterans, that I say that the harm is in the delay. And I'm reminded of a quote from the VFW's Pat Murray that we had in yesterday's roundtable on toxic exposure. Our pay for this bill, and our pay for, frankly, for all that we do for veterans was the ticket that we sent service members overseas to serve. I repeat, our pay for was the ticket we sent service members overseas to serve. And a little further discussion on the pay for issue. The Congressional Budget Office does not estimate that this bill will increase mandatory spending and does not require an offset. These are the rules we play by. And again, we're not creating new eligibility here. The only cost of this bill is veterans seeking care that they already are eligible for. We're all better off when veterans are seeking the care that they need, and we should not be hiding that care for which they're eligible. Automatic enrollment in VA health care for eligible veterans is a long-needed suicide prevention tool. We cannot put a price tag on protecting the health and safety of our veterans. And many of these veterans would go on to use VA health care even if they are not automatically enrolled, and the minority does not give a compelling reason why we should hinder or make that process more difficult for our veterans. And again, I repeat, we should not be hiding the care for which our veterans are already eligible. So thank you, Mr. Speaker. I ask that all my colleagues join me in passing H.R. 4673 as amended, and I anticipate we will see a big bipartisan vote today, and I yield back the balance of my time.
The gentleman yields back. All time for debate has expired. Each further amendment printed in Part B of House Report 117-225, not earlier considered as part of amendments on block pursuant to Section 5 of House Resolution 860, shall be considered only in order printed in the report, may be offered only by a member designated in the report, shall be considered as read, shall be debatable for a time specified in the report, equally divided and controlled by the proponent and an opponent, may be withdrawn by the proponent at any time before the question is put thereon, shall not be subject to amendment, and shall not be subject to a demand for division of the question. It shall be in order at any time for the chair of the Committee on Veterans Affairs or his designee to offer amendments en bloc consisting of further amendments printed in Part B of House Report 117-225 not earlier disposed of. Amendments on block shall be considered as read, shall be debatable for 20 minutes, equally divided and controlled by the chair and ranking minority member of the Committee on Veterans Affairs or the respective designees, shall not be subject to amendment, and shall not be subject to a demand for division of the question. For what purpose does the gentleman from California seek recognition?
Mr. Speaker, pursuant to Section 5 of House Resolution 860, I rise to offer the 4 amendments en bloc to H.R. 4673.
The clerk will designate the amendments en bloc.
On block number 1, consisting of amendments numbered 1, 2, 4, and 5, printed in Part B of House Report number 117-225, offered by Mr. Takano of California.
Today in support of
Pursuant,
these...
the gentleman yield. Pursuant to House Resolution 860, the gentleman from California, Mr. Takano, and the gentleman from Illinois, Mr. BOST, each will control 10 minutes. The chair recognizes the gentleman from California.
Mr. Speaker, I rise today in support of these en bloc amendments, seamlessly connecting veterans with the benefits and care they've earned through their service is paramount to the transition process. The Delgado Amendment number 1 makes sure that VA can easily notify veterans regarding care and services through mass texting. As technology and communication methods improve, so should how VA uses those capabilities to easily inform veterans of their benefits. Texting eligible veterans to tell them they have been auto-enrolled in VA healthcare is an effective, simple way to increase awareness of the care available to them. The Delgado Amendment number 2 requires GAO to submit a report to determine the best methods to notify veterans regarding their automatic enrollment in VA healthcare. This amendment will strengthen the underlying bill and informs best practices for how VA can ensure veterans have the information they need regarding their access to care and services. Getting information to veterans in an effective manner is crucial to their transition to civilian life, and the Delgado Amendment number 2 will help improve how VA communicates an eligible veteran's enrollment in VA healthcare so they can easily access the care they need. The Hayes Amendment requires that VA notify veterans who opt out of automatic enrollment that they may elect to enroll at a later date. We understand that there will be some veterans who opt out from auto-enrollment for a variety of reasons, but it is our duty to ensure that they know that the VA will be waiting for them if their future needs change. Ensuring VA adopts and scales best practices related to auto-enrollment while also learning from any issues that arise during its rollout is important to the long-term effectiveness of the aims of H.R. 4673. The Talib Amendment requires VA to submit a report a year after the first veteran is auto-enrolled in VA healthcare to preserve lessons learned from the rollout. This report will help improve auto-enrollment for both the VA administrators implementing the program and veteran users alike. I urge my colleagues to support the en bloc amendments, and I reserve the balance of my time.
The gentleman from California reserves. The gentleman from Illinois is recognized.
Mr. Speaker, I yield myself as much time as I may consume.
Gentleman is recognized.
Thank you, Mr. Speaker. The 4 en bloc amendments are offered by Congressman Delgado, Congresswoman Hayes, and Congressman Taleb. I thank them for their work. I remain opposed to the underlying bill, and I explained why in the details over their last debate. But one of the reasons I was opposed to it is because VA committee did not do our job before bringing this bill to the floor. We did not hold hearings on the bill or seek input from stakeholders. And importantly, we did not get assurance from the VA that the bill could be implemented without negative impact to services. In fact, shortly before this bill hit the committee, the Biden administration did release a statement that we talked about earlier. That statement, remember, says that there's challenges in implementing this bill. Now, I wish we could have done that work on the VA committee before considering the bill on the floor. If there are challenges, we need to know about them, and we need to be able to address them to make sure that no veterans is harmed by this bill. Nevertheless, here we are. So these en bloc amendments will help get some of the information we should have gotten passed in the bill. They will help us stay informed on how the bill is working and the impact it is having on the veterans and on the VA healthcare system after the fact. For example, one of Congressman Delgado's amendments would require GAO to study the best methods for VA to notify newly separated service members of their enrollment status. His second amendment would require VA to consider texting newly separated service members to inform them of their enrollment status and their ability to disenroll. If a veteran chooses to disenroll, Congresswoman Hayes' amendment would require VA to provide them with information on how to enroll at a later date if they change their mind down the line. Finally, Congresswoman Tlaib's amendment would require VA to report to Congress on the implementation of this bill not later than 1 year after enactment. That would allow us to course correct or as needed if the bill is causing problems at least 1 year out. Now, I feel like a broken record about this information we should have had already, but nevertheless, it's better late than never. That is why I will be in support of the amendment, of the en bloc amendment, alongside the amendments for Delgado and Hayes. I urge my colleagues to do the same, and I yield back the balance of my time.
The gentleman yields back. The gentleman from California is recognized.
Mr. Speaker, may I inquire how much time is remaining?
The gentleman has 7.5 minutes remaining.
Thank you. Mr. Speaker, at this time, I'd like to yield 2 minutes to my good friend who serves on the House Armed Services Committee as chairman of the Sea Power and Projection Forces Subcommittee and the Education and Labor Committee, to the gentleman from Connecticut, Representative Courtney.
Gentleman is recognized.
Thank you, Mr. Speaker, and thank you, Mr. Takano and Ranking Member BOST, for supporting the en bloc. It is my honor today to speak on behalf of the Hayes Amendment offered by my friend and neighbor from Connecticut, Congresswoman Johanna Hayes, who unfortunately could not be here today because she is quarantining. Her amendment is a common-sense proposal to improve an already outstanding bill that will connect more veterans to benefits they've earned by volunteering to wear the uniform of this country. Mr. Speaker, last year at the outset of the VA's highly successful COVID vaccination program, Congresswoman Hayes and I both toured the VA hospital in West Haven, Connecticut, which is the flagship of our state's VA healthcare system. I had a chance to personally observe her authentic, well-informed advocacy for veteran patients and their family members, asking questions about ways Congress can improve the system, particularly about communicating the full extent of their benefits. She described casework from veterans seeking care about the burdens they face navigating a complicated system where not only veterans but family members struggle to stay current with changing rules and programs, which is particularly troublesome to hear cases of veterans who lose eligibility for help because of late claims caused by poor communications, often at times of discharge from military service. That's why it's so important for the House to pass the eVest Act, which will provide automatic enrollment in the VA system for all transitioning healthcare for transitioning service members. Ms. Hayes' friendly amendment wisely requires that the VA go the extra mile and inform veterans who opt out of automatic enrollment through multiple methods, including not only email but also paper mail, that they can re-enroll as they transition out of the military. Her measure is a common-sense assurance that veterans are informed of eVest so that they know from day one all the options and rights that they have to get help. I want to thank again Chair Takano and Ranking Member BOST, and close by simply noting that in my district in Eastern Connecticut, which is home to the largest military installation in New England, with 9,000 sailors and officers who work every day to protect our nation, the transition from military to civilian life happens on a rolling, nonstop basis, and too often we work with veterans who experience gaps in benefits caused by failure to enroll or late enrollment. I urge my colleagues to support the Hayes Amendment in the en bloc and the underlying bill. I yield back.
The gentleman yields. The gentleman from California is recognized.
Mr. Speaker, I now yield 2.5 minutes to my good friend and author of this amendment. She serves on the Financial Services Committee and the Natural Resources Committee and the Oversight and Reform Committee. The gentlewoman from Michigan, Representative Tlaib.
Thank you so much.
The gentlewoman is recognized.
Thank you. I want to begin by thanking Chairman Takano and the committee staff for working with me on this important amendment and for their leadership on this bill. I can't thank him enough and look forward to him one day coming to my district to come and visit one of our VA hospitals that we love and cherish. The transition of being an active duty to be, for our veterans, is not easy, transitioning from being active duty. And eVest Act helps with that transition and makes life easier for those who served our nation. This act is also a great opportunity to review the automatic enrollment programs and learn what works and what doesn't, because ensuring effective implementation is critical to its success. I'm a social worker at heart, and we have to make sure and ensure that our veterans' lives are changing for the better with this bill. So my amendment ensures the lessons learned during the implementation of the program are preserved for other agencies, as well as to learn, again, what to do and what not to do. And again, I appreciate, again, the committee and for working with me on this, and look forward for my colleagues in supporting this amendment. And I also look forward to working with the committee on a number of other issues impacting our veterans, especially veteran suicide and access to mental health services. With that, I yield, and again, thank the committee.
The gentleman from California is recognized.
Thank you. I thank the gentlelady for her amendment. At this time, I'd like to yield 2.5 minutes to my good friend and member of the Financial Services Committee, where he's chairman of the Oversight and Investigation Subcommittee, Chairman Al Green from the great state of Texas.
Gentleman is recognized.
Thank you very much, Mr. Chairman, and still I rise. I thank the ranking member as well for what he did to help me with the Merchant Mariners, as well as the chairman. Mr. Speaker, by way of further introduction, I'm the same Al Green who lives across the street from the DeBakey VA Hospital. The same Al Green who fought in this Congress to secure a Congressional Gold Medal for Dr. Michael E. DeBakey. The same Al Green who has 800 flags outside of his office presently to be distributed over at the DeBakey VA Hospital. The same Al Green that goes there annually and speaks to veterans. I talk to them about their needs on an annual basis. I do this. The same Al Green who has had veterans to tell me the difficulties associated with enrollment. The same Al Green who has veterans to say they're so pleased that somebody would come by to be of service to them. And this Al Green announces here and now that I will support the underlying bill. I support it because it is necessary. I support it because I believe the veterans that I have spoken to will support it, and they need it, and they will enjoy knowing that we came to this floor to bring this to fruition. And finally, this. If the VA hospital is not properly funded and this creates some funding issues, I'm prepared to vote to fund the VA hospital sufficiently so that our veterans can be taken care of. Anyone who's willing to go to a distant place, who may not return the same way they left, who may have issues for the rest of their lives, and they do it because they want to protect this country, I'm going to do all that I can to protect them. This is the least a grateful nation can do. I yield back.
The gentleman yields. The gentleman from California is recognized.
Mr. Speaker, I have no further speakers. I'm prepared to close. I know that the ranking member has yielded back his time, and so let me just, in closing, say that I ask all my colleagues to join me in supporting these four amendments, and I yield back the balance of my time.
The gentlelady is recognized. Oh, the gentleman yields back. Got it. Thank you. Pursuant to House Resolution 860, the previous question is ordered on the amendments en bloc offered by the gentleman from California. The question is on the amendments en bloc. Those in favor say aye. Those opposed say no. In the opinion of the chair, the ayes have it. The en bloc amendments are agreed to. Without objection, the motion to reconsider is laid upon the table. It is now in order to consider amendment number 3, printed on Part B of House Report 117-225. For what purpose does the gentlewoman from Texas seek recognition?
Mr. Speaker, I have an amendment at the desk.
The clerk will designate the